This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor. Welcome to
Healthcare Snitches.
Hi, everyone.
Hello.
All right, so this episode we're going to discuss cancer screenings. So the different types, recommendations on when you should go for them, what we think about them, and common symptoms.
Okay, so the topics that we are going to hit today are lung cancer, colon cancer, breast cancer, endometrial cancer, prostate cancer, and cervical cancer. And we are just going to discuss the importance of getting tested and screened for these different types of cancers. And as Jasmine said, the signs, and not just pushing stuff off like, oh, well, I don't think that I have prostate cancer because X, Y, and Z is going on, right?
Right.
So let's start with mammograms. So what I did was I did a little research on the American Cancer Society and what they are recommending for the age ranges. So they said women ages 40 to 44 should be screened for breast cancer just to start, and then annually you should go between 45 and 54, and if you're 55 and older, maybe every couple of years.
So what's the screening for breast cancer?
It's a mammogram, or if you have dense breasts like myself, then they will send you for a mammogram and for an ultrasound. So there are some things that a mammogram could possibly not pick up. So they send you for an ultrasound so that they can make sure. So
what if you have a family history? Like, should you go earlier than that?
You are speaking to a hypochondriac right here. So in my opinion, yes. And I'm big on making up a story so that I can get screened.
Ooh, child.
I'm big on telling my friends what they should say so they can get screened
before
the recommended age, because some things won't be covered by insurance unless you are a certain age or unless you have certain symptoms before that age. So for me, I go every single year and I get a mammogram and an ultrasound. And I must admit, I was late going for my first mammogram. I was supposed to go at 40. As Jasmine knows, I didn't go until I was 42. And when I went, they called me back because they saw something. And it's pretty common to get called back if it's your first mammogram because they don't have anything to compare it to. So they called me back. I did another mammo and another ultrasound. Guess what? They sent me for a biopsy. So here I am planning my death because I was so afraid. I just knew I had breast cancer. And they did a biopsy. It came back benign. It was like fibrocystic breast tissue. But this is why it's important, guys, because if you do not go for a screening, you will never know. And it's important, I hope that you are also doing it, to do breast exams while you're in the shower. Just...
I'm not doing it.
Palpate.
I should be.
Important.
I'm sorry, guys. I should be. I know better. But
you know how many women find things themselves?
So the reason why I personally don't is because I traditionally have a lot of like fatty tissue in my breasts. I've had a reduction. And so when I feel around in there, everything feels like something. And so if to me, everything feels like a lump. It just feels lumpy. I don't know what it would feel like if I found something like, but it feels kind of lumpy in there to me. And so when I was like first doing that, I would freak out because I think everything is a lump. So that to me is scary. So that's why I don't do it. I just wait until my annual pap smear appointment where they do it for me, or if I go to my doctor. But traditionally I don't, which is not recommended and not good. But I'm just telling you guys why I don't.
So I recommended to Jasmine a couple of years ago that she get herself into a doctor's office with some lies, okay, so that she can get a mammogram. And I would really do it now because you assist a lump a lot, okay? So Don't be like Jasmine.
Don't do.
Do your own breast exams. Do it while you're laying down on the bed. Put your arm up over your head and just feel. If anything feels strange or anything hurts, you should probably call your doctor, right?
Yeah. I think also for me, because I did have that reduction 2 years ago, they looked in there. So I was like, oh, if there's anything in there, they would tell me, right? Which they would, because I asked the surgeon. Also, they sent off my tissue for like
to
pathology so that it can be checked for all that stuff as well. So that's part of the reason why. But really, also, I think that if I did feel something, it would be much harder than the typical like fatty tissue that is present that I'm more so scared of, that I'm used to feeling.
Well, a lot of women who have a lot of boobies,
I can't.
Sometimes they have something that is called fat necrosis, and you can feel it most of the times. And sometimes it pops up on the mammogram as suspicion.
Ooh.
And then you end up getting a biopsy. And then it comes back as being benign, and it's fat necrosis. It's not cancerous. So a lot of women with fatty breast tissue go through that. Okay, so that's breast cancer. Do you have anything? Oh, one other thing. Do not wait until Breast Cancer Awareness Month, which is October, to go for a mammogram. It's so hard to get an appointment then. It's like super hard. So try to go before then. And also, if you get called back for a biopsy like I did for the second time. When did I get a biopsy? In the end of July, beginning of August. So now I'm due for my 6-month follow-up to just make sure that nothing grew even bigger, even though it came back benign. Always go back for your follow-up appointment because things can change within 6 months and it doesn't always have to be good news. So always make sure that you follow up. Do it for yourself. Do it for the people who you care about. Do it for people who care about you. And if there's any women in your life who need to go for a mammogram, just try to push them. I don't know if you saw the other day the CNN anchor.
Yeah, I did. I did.
What is her name?
I don't remember.
Yeah, she just came out and told us that she has stage 3 breast cancer and she's been getting chemo for the last 2 months, and yeah, it's very heartbreaking. For some reason that hit me hard. I don't know if it's because I'm supposed to be going back next month for my follow-up, but I just felt something.
Yeah. A lot of times women will feel something is wrong, in their breasts, or they'll feel it, or they'll have pain or redness, because it's not always a lump that you can feel. Sometimes it's just like pain.
Mine wasn't.
Right.
Last time.
Sometimes it's just pain or redness in an area, or like discoloration. Or nothing. And so that's why it's really important just to go for those mammos and to also do the self-exams. I think another thing in as it relates to all of these screenings is that with COVID, what we saw were a lot of people just really hyper-focused on COVID and not even going for any other tests, right? So what we're seeing now in the last few years, post-COVID, even though to me there's no post-COVID because
it's still going on.
Here forever, right? It's part of our lives. But post, I guess, pandemic, where it's like mass hysteria and all of the other things, we're seeing the rise of chronic conditions being diagnosed now. So whether that's cancers or diabetes or obesity, whatever it is, now people are saying, okay, now that we're out of the fog of COVID, you're seeing all of these breast cancers, brain cancers, colon and rectal cancers are on the rise. All of those things. So you do want to make sure that you're just getting screened. I know it's very scary. And that is part of the reason why I don't even do my own like examinations. But if you catch it in its earlier stages, you're more likely to be able to treat it and beat the cancer, right? If you notice a symptom and you keep putting it off, you don't go for that screening, you're more likely to be in a more advanced stage of it. And therefore, you'd either have to do more aggressive treatments, or you've been placed in a position where you don't have a treatment option, right? The treatment option is kind of just waiting it out. And we never want to be put in that position. So even though it's scary, if you have at least one person you can confide in to help get you through, I would recommend, we both would recommend that you take the steps to be screened.
Jasmine took me for both of my biopsies. One was in 2021 and this last one was in 2023. And she was my ride or die. She took me for both. During the 2021 when you couldn't come in because of COVID.
Yeah.
So she waited in the car. But this last time she was able to come in, and it really is helpful if you have someone who is supportive. It really does help. So like she said, pick that person and do what you have to do. And it is very, very scary.
Yeah.
It is. But it's better to be safe than sorry. And also, one of my old coworkers who you also work with too, but we work with her at different times. Remember, her breast cancer was found during intercourse with her husband. He felt a lump on her breast, and then she went to the doctor, and it turned out to be breast cancer.
Yeah. I've also heard stories on social media of
one night stands.
No, of it being found in that way too, right? So, if you don't want to feel on yourself, somebody's feeling on you and they feel a lump.
Mm-hmm.
So there's ways, but the best way is obviously to go get that screening. And I understand, I've never had one, that mammograms are not fun.
Oh my God.
I'm pretty sure if men had to get something squoze like that, then they would find a better way. But because it's us, we get them flattened like pancakes in a press.
It's really a lot of compression. And also to the men, if you guys feel lumps, you need to let your doctor know, because it's rare, but it does happen that men also get breast cancer.
Yeah.
So don't just brush it off either.
Right. And I also feel like, I know we're focusing a lot on breast cancer, but breast cancer is also one of, and any of these really, but I feel like people think that they have to have a family history to be diagnosed, and that is just not the case, right? So you do not have to have a family history, and I'll just leave it at that. It can happen to anyone.
It can start with that person.
Yeah, right.
Because it does have to start somewhere.
It does, unfortunately. So.
Okay, so another screening that we would like to discuss is colon cancer. As Jasmine said, lately, a lot of young people have been coming up with colon cancer. And remember our coworker, his sister died at 25 from colon cancer. Mm-hmm. It does happen, and we are seeing it happen in younger and younger and younger people. So the recommended age is 45 to 75. Me personally, I had my first colonoscopy at 39. My mom died from colon cancer when she was 56. So you are supposed to get a colonoscopy 10 years prior to the person who passed in your immediate family. So technically, I wasn't supposed to get one until 46, but I was having issues. I was having rectal bleeding, which we now know is hemorrhoids. Mm-hmm. I was having severe nausea, so I was having upper body issues too. A lot of gas issues, a lot of indigestion, just pure misery. So not only did I get a colonoscopy, but as I like to say, I got it from the rooter to the tutor. So they went in through my mouth, which is an endoscopy, which shows the upper GI, and then a colonoscopy, which shows the lower GI. Mm-hmm. And they took a biopsy of my stomach as well. That was at 39. I'm actually due for my next colonoscopy. Mm-hmm.
As I checked in, I was like, "Oh, yeah, you should be due for a colonoscopy right about now."
I am.
So get you some friends that will remind you that you're due for a colonoscopy.
Well, not only did she remind me, but back in September when I had my primary visit with Dr. Camacho, he was like, "Look, it's time for you to get your colonoscopy next month." So
that's because he's a good PCP.
He is. So me and my drama, I can take but so much at once. So I'm going to wait until I'm cleared by the breast surgeon and I'm cleared from my mammograms and I'm back on my annual screening. So next month is my follow-up. I can only deal with one cancerous scare at a time. Okay. So once that's done, I'm going to find a new gastroenterologist because the last one almost let me die. Remember that? with the
yes.
Yeah. So I need to find a new doctor, and then I'm going to get my colonoscopy.
Yeah,
by the summer.
And I'll also add that I had a colonoscopy as well at, how old was I?
37.
37.
Yes, she did. Hallelujah.
And I did because I was having some symptoms, right? And also because of Chadwick Boseman, I was like, you know what? No, I'm having these symptoms. I have had symptoms in the past where I felt like, you know what? It's just like, let's just get this checked out. I will say, and this is a complaint that we get from people who are even in the age range, which they've kind of moved it up to 45 now.
Yeah.
Whereas previously,
they moved it down. Right?
Yeah. So before it was like 50. Okay.
And it should be lower.
It should be lower because, as you can see, people in their 30s or whatever are coming down with things. But I will say the thing that scares a lot of people from getting a colonoscopy is for a lot of the men, it's the idea of having the colonoscopy. What people don't realize is that you are not awake for that. And so you don't even know what's happening to you, and you don't feel it afterwards. It's not like you can feel that something happened to you. They're very macho about that. So that's one thing that we get from men. But mostly from everybody is that they don't want to do the prep.
The prep is horrible.
There's, depending on which doctor you go to, will depend on what they use as their preparation process. I will say for me, I did not enjoy the prep. My doctor had me do a 2-day prep, which
I've never heard of.
I know, in which I had to do, you can only do like clear liquids, or I feel like it's liquids of a certain color.
Yeah, you can't do red and orange because they can pop up as being possible blood.
Right. So I had to do that with like Jello or whatever, and Miralax and a whole bunch of nonsense and Gatorade. And I felt like I was going to die before I made it to the situation. And
you a week walking in there.
Yeah, you're weak walking in there. Yeah. You're just like, get this over with.
Put me to sleep. Put my IV in.
Right. I felt like crap actually going into it. So much so that when I prepped for another surgery that I had recently, and the prep was a week long as opposed to the 2 days, I didn't think I was going to be able to do that prep because the colonoscopy prep almost took me out. But completely different, and you know you're clean when you know. I'll just put it that way. But do not be scared of the prep. Because it's just something you have to do. It has to be clean for them to be able to get a good visual of what's happening, right? So if you do have polyps, they'll be able to see them. They'll be able to biopsy them. They cannot see that if you have a whole bunch of waste in your colon or in any of your parts of your tract, right? And then I also had an endoscopy at the same time as well. So I got the rooter to the tutor because I was having some reflux issues. And then immediately after, they're able to just tell you like, hey, we saw something that looks suspicious. We were able to take a biopsy. You'll know immediately when we get the results. But it immediately gave me some reassurance when they said we did not find anything to even send off. I did have like a little hernia is what they said. But other than that, it just like put my mind at ease. And from a clinical standpoint, colonoscopies are good for 10 years.
Yeah, good for 10 years
unless you find something that's suspicious.
Or unless you have a family history like I do. Then you should do it every 5 years.
Yeah. And so, because these polyps, right? So, I mean, I should have done more research before starting this, but just my knowledge is that these polyps actually take quite a while to grow and turn cancerous.
Yeah, most of them are slow growing.
And so that's why it is the 10 years, because if you catch it, let's just say you catch it in its earlier stages, it's treatable. They can either remove it, or depending on what it is, I don't know, once they send it off for a biopsy, they'll tell you what your treatment plan would be. But that's why the screening is so important.
Yeah, by the time my mom found her. She was 52, so she should have gotten a colonoscopy at 50. It's a strong possibility that she had cancer 2 years prior then, but maybe it wouldn't have been stage 4. Maybe it would not have spread to her liver by then, right? Yeah. And when they did her surgery, it's called a colon resection. They took out, I forget how much of her colon, but they took out part of her colon, and she was cut from here to here, and she was in surgery for 7 hours. So why go through all of that? Why go through all of that when they could possibly find something early in stage 1, maybe, or maybe stage 0? Maybe it's not even stageable yet, right? Yeah. But I just wanted to say, from you talking about the prep, do you remember my prep? Mm-hmm. I was supposed to drink 2 bottles of Gatorade with the Miralax in it. I got through half of a bottle because I'm not a big drinker. And I cried because I was like, oh my God, my mom died from colon cancer. I'm not going to be able to do this. And I took the 4 Docalax that they told me to take. But when I went in that next morning, I was first case. And I said, just do the endoscopy because my prep is not done properly. They gave me an enema. They gave me a blanket, laid it on the bathroom floor. I had to lay on the floor with a pillow. I'm always so extra. I can't. The good thing is that they had cleaned it and no one was in it yet because I was first case. And I had to give myself the enema and then get on the toilet. You have to go until it comes out either yellow or clear. And just half of an enema, it was like yellow and clear. So I basically did what I should have done, but not with everything that they had given me to do it.
We don't advise because some people are full of crap, right? And you may not be that lucky, right? So sometimes if your prep is not well, they're not going to be able to do the colonoscopy. They'll get in there. Have we seen reports?
We've seen reports
where it says poor prep. Where we'll see pictures of the colon
full of feces,
because we would look at these things.
We had to for work,
for a part of our job, and you can see it, and
it's disgusting.
It looks so gross.
And then you see some with a clean colon, and you be like,
your prep was good.
Yes, look at God.
Yeah,
it's
clear. And so now you see why the prep is important, because you can't see any polyps amongst poop if you're doing the colonoscopy. And I would just be fed up and tired as a colorectal surgeon, like. Well, I can't see anything.
How many of them say poor prep, and then it says recommends patient does again in 6 months?
Right.
So they bow out gracefully. They stop. There's no colonoscopy.
There's nothing they could do. It's not like they get in there and they could they can sometimes
but that probably causes a mess.
Yeah. Ooh, sounds gross. But anyway, so you gotta weigh. One thing that I've been kind of practicing in my life is like choose your hard. So it's either you choose the hardness of the prep and the idea of it, or you choose the hardness of going through a 7-hour surgery and having part of your, colon removed and possibly having a colostomy bag at some point. So choose your hard, which it's like a shit and shittier option.
Either way, it's a shit show.
Yeah.
But remember what I said last episode. You either take good care of yourself now or you take good care of yourself later when you're sick.
Yeah.
Either way, you have to take care of yourself.
Yes. So. And trust me, one feels much better than the other, not only to yourself, but also to those around you, right? Because the people that care about you want you to be here. They want you to be here to experience, things in your life and their lives. And they want you to be well doing that.
I also wanted to just mention, some people are very adamant about they will not have a tube going up their rectum for whatever reason.
Yeah.
Whatever.
The men is what we see. They're like, oh, absolutely not.
And sometimes the wives, which I've seen at work, piggyback off of what the men are saying. He's not doing it. I'm not doing it. So there are other things that you can do. Stool sample test. You just poop. Get a stick, smear it.
I don't
put it in the mail.
Yeah,
mail it out. Now, if they do see any blood particles in there, they are going to recommend that you get a colonoscopy. If it's negative for any type of blood, then they'll probably say it was negative and that's it. Me personally, I can't put all my faith into poop on a stick.
And it's actually not recommended for someone with a family history to do the cards because it's just not as reliable.
It's not.
And also for the cards, so colonoscopy, like I said, every 10 years, right? For the cards, you have to do that every 3 years.
So for the fit test,
every year,
but for Cologuard,
it's every
3 years.
Right.
Yeah.
So
if you're with the upper crest and you do Cologuard,
yeah, right. Which both of those tests check for different things.
Yeah. Cologuard is probably more reliable.
Yeah.
Not that I'm doing a Cologuard commercial right now.
Right. We're
because
not.
I'm definitely not.
But one test is looking more for the presence of blood.
Yeah.
Where the other is looking for looking at the DNA of
it's like more. It's 11 biometrics that they are actually checking for.
Yeah.
So yeah.
So again, still good if you are really hesitant about the idea of the prep and actually having the procedure of a colonoscopy. But what's really going to give you your best, like most definitive answer is a colonoscopy.
How about the virtual colonoscopy? I know.
Excuse me, what is that?
Mount Sinai was.
What does that even mean?
It's a pill.
You put. Oh.
Wait, what?
I thought they mailed you a scope and you just did it yourself. Or maybe your boo doesn't.
I'm so done. I'm so done with her.
I'm done too.
No, it's a virtual. It's
God.
like a capsule that you swallow. I heard it's a little on the bigger side. It's a capsule that you swallow, and it's like a camera attached to it. And it goes through, and then
they can get from the rooter to the tutor.
They get the report. Yeah.
Again, I'd love to see the results of that and the efficacy of how well it detects. Again, if they find something in that, guess what? You're still gonna have to go and get it biopsied.
You're gonna have to do a biopsy, so you still have a scope up your butt.
You may as well just get it over with, do the prep, get the colonoscopy. They'll do it all at the same time, and you'll be good to go. You won't have to do all these things. But we understand some people are just too scared to do it, and so
a lot of the fear is generational, though.
Yeah,
which is unfortunate. Granny didn't do it, so I'm not
right. So being, working in this field, my mom is a nurse. She has been a nurse for a very long time. When it was time for her last colonoscopy, she did one of the cards. After I told her not to, I said, and I don't mean to be putting her business out here, but
she'll probably never see this.
She'll never see it. I said, you have hemorrhoids, and so that card is probably going to come back positive, and then you're going to have to get a colonoscopy anyway. So let's just do the colonoscopy. She's like, but I don't want to do the prep.
It's hard when you have hemorrhoids to do the prep, though. That's my biggest fear.
I get it. But also for the reason I said, which is I said what I said. The card is going to be positive, and then we're all going to be scared. Okay, so just do the colonoscopy. Anywho,
she didn't listen.
She did the card. Guess what? Came back positive. So
it was extra scary because her H&H was kind of low.
Exactly.
Her blood count was kind of low.
Exactly. And so now we're all panicking.
Like, oh my God, where is she bleeding from?
We don't know where she's bleeding from. And now she got to do the prep anyway. Did the prep, took her for her colonoscopy again during COVID. Couldn't go in with her, but I went back and picked her up afterwards. And she was fine, right? But that's just a lesson in, generations of, I don't want to do it.
A foolishness.
For whatever reason. We are still working on the other screenings. But again, this is someone who is in healthcare, has seen a lot of things, which is part of the reason why she is so scared to do it.
Nurses are like the worst.
Nurses are the worst patients. She's seen so much that she just, sometimes it's hard for her.
It's scary.
But I feel that I was placed in her life to make her do these things.
No, definitely. Yeah. Definitely. And she kind of ended up at the same destination. She just took a different path.
She did. Right. Which, whatever. When I was a kid, I guess I did the same thing to her. But here we are.
All right. So that was colon cancer. Now we're going to talk about cervical cancer. And January is Cervical Cancer Awareness Month.
Yes.
Now, how many of you chicks out here in these streets, okay, and you not getting your coochie papped and smeared annually?
Yeah.
Okay, The American Cancer Society is recommending that you start at age 25, and that after 65, no one cares.
Right. They're like 65 and up?
Yeah. So they are recommending
that every turn to dust. You can't have kids. We don't care. I mean, it happened way before that, but goodness.
So they are recommending, this is what they are recommending, okay? Every 3 years, you get your cooch papped and smeared. And every 5 years, make sure that during that pap and smear that you are being tested for HPV. Now, HPV has so many different strains. It can lead you down a path of cervical cancer, or it can lead you down a path of genital warts.
Yeah.
Either path is not good. So you don't want to be down either path.
You don't.
Jasmine and I are different. We go annually for our screenings.
Absolutely.
And it just so happens that our doctors, because we go to 2 separate doctors, have the HPV and PAP tests right there. So they do both at the same time. But cervical cancer, and I hate to say this, please refer back to the disclaimer that you heard in the beginning, but cervical cancer is probably one of the best female reproductive cancers to have, because if it's caught early, you can just get rid of all those organs that you have in there, all of those reproductive organs, and there's like a high success rate with it if it's caught early enough.
Yeah.
It can take you out, but that's normally if you're not getting your
screening. Yeah. And you can be 66 or you could be 24. Mm-hmm. It really doesn't have an age on it. I know these screenings have a recommended age, but like Kim said,
Katui with the recommended ages. Do it sooner.
The recommended ages, and also I think it's based off also on your activity, right?
If you in these streets.
So if you are sexually active, you should be getting that checked out at least once a year. Obviously, if you have some type of symptom, go into your doctor for that. If you're experiencing any weird discharge, abnormal bleeding is common with cervical and endometrial cancers.
Odors.
If your cycles are off or different, any changes, you should definitely consult with your OBGYN or your primary doctor so they can refer you to one.
AKA know your cooch.
Yeah. I think a lot of these come down to knowing your body, but as women, we don't, unfortunately, some of our mothers do not teach us about these things. I know for me growing up, in a West Indian household, no, we were not talking about none of this. We were not talking about any of it. And so we will have a specific episode on sexual health, but one generational curse that I plan to break is discussing everything from the rooter to the tutor. And when I say everything, I mean everything. So, what is your discharge supposed to look like? What is abnormal? Once you do start becoming sexually active, which like never, whatever.
Not in this house.
Right. What you need to do to protect yourself, right? pH balance, talking about that. And also just the importance of going to the doctor regularly. So
and
I know
protecting yourself too.
Right. I just said that.
Oh, did you? Sorry. I had left the building. I had left the building for a second.
But I think, dang, I was going to say something. I forgot.
Sorry. Mm-hmm. Protecting yourself.
What was it that? About protecting yourself.
Wow, Jasmine thinks about what she said. Remember, birth control pills do not protect you from STDs and HIV. Okay.
They don't.
And I feel like growing up, parents were more so on birth control.
Yeah, because I feel like the 80s and 90s were more like, don't get pregnant.
Yeah.
Don't get pregnant. Don't get pregnant because we don't need another mouth to feed up in here and you're too young, so I'd be taking care of the child. But also protect your your vaginal flora, your pH balance.
Yeah.
But also like protect yourself from things like HPV and bacterial vaginosis and yeast infections. All these things kind of go into your vaginal and your cervical health. Mm-hmm. I think a lot of people don't even really understand the anatomy that they have either. So you don't realize what your cervix is
and where it's located,
right? What your vulva is, what your vagina is, all of just the parts of it, and you can have cancer in any one of those parts. Just as an FYI, but we really focus on cervical because you can be impacted by just the changes that take place in the cervix. I think it may be one of the more common areas you get cancer in.
Yeah.
In the female reproductive system.
Also, follow up, right? Let's say you get a pap smear result that shows that there were some cancerous, that there were some changes in your cells.
So you had an abnormal pap. So once you had your pap smear, it comes back. They tell you it's abnormal, which could be for several reasons, but you just never know.
Make sure that you go back. If they want to do any procedures, whether it's a cone biopsy, a colposcopy, whatever it is that they are telling you, you need to go back. It's scary. Yes, it is.
Very.
It's very scary. It's very uncomfortable.
Yeah.
But just do it. It's fast. It's fast, and then you'll get your results and you'll know. And then you have to, after those tests, you normally have to go back within 6 months to get another pap smear, right? Is it 6 months? Or 3?
Depending on the result of the biopsy,
yeah,
and your doctor will depend on when you have to go back. So, just for full transparency, I've absolutely had abnormal paps for various reasons.
I've had it once.
I've had to go back and get biopsied.
Me too.
And so, thank God, none of those ever came back as being abnormal after the biopsy. But what I've been advised to do is just to follow up with my next pap the following year. So whereas they say you can go every 3 years, if you have an abnormal pap smear, you should get a pap the next year. I have had normal paps as well, and my doctor will say, "Oh, just come back in 3 years." I still go back the next year.
Yeah,
because
so much can happen.
Like you just don't know, and I would hate for something to like be brewing for 3 years, and I just don't know. No, I'm not. I can't personally mentally do that, so I will go back.
Yeah. So Jasmine said it depends on the doctor. My gynecologist at that time, he made me come back in 6 months, and he said if that too came back negative, then I could go back to my annual paps. So yeah, so make sure that you guys do this. This is very important. Don't be afraid. Be afraid of what can happen if you don't do these screenings.
Yeah, you should be more afraid of that.
Okay, so the next one is endometrial cancer. So normally doctors start looking into this around the time of menopause. If you are no longer getting your menstruation and you are in menopause, any postmenopausal bleeding makes doctors' eyebrows go up because it should not be happening. It shouldn't. Could it be caused by your hormones and stuff, especially if you're on like hormone replacement therapy? Of course. But it makes their eyebrows go up. A lot of times it's linked to uterine cancer. So make sure that you are just keeping an eye on spotting bleeding once you are postmenopausal. It's very, very important. Anything you want to throw in there for endometrial?
I don't know much about it, but one thing I will say is that recently I have heard a lot about this lawsuit that's out there for the hair relaxer.
Oh, for the hair relaxer. Yes.
So it's like if you've been diagnosed with cervical, endometrial, or uterine cancers, and you used process like relaxers to straighten your hair, there's a class action lawsuit going on right now because apparently they've been linked to those types of cancers as well as like fibroids. So I found that to be very interesting. I didn't really dig too much deeper into that, but that would be something that I would be curious to understand how they're linked, and like if you let it burn a little bit on your scalp, were you more likely to get like, I don't even know. But
I know, because I feel like African American women at one point in most of our lives we've had a relaxer. Does it take one relaxer?
Right? Does it take 10?
Yeah.
Like what are we talking here? Like what is the cohort here that made it a class action lawsuit to say that this is exactly what caused it as opposed to something else? I would love to understand more about that. But it's just interesting how environmental factors, so not only environmental, but just like things that we ingest, not only eating, but also like through our skin, our scalp, our nose, our body, impacts the way these cells, right? Because we talked about this before we started, but how cells can just become cancerous, right? And
we're full of cells. That's what we are.
Right. And like where they decide to do that, right? It could be any one of these parts of your body. Like, scary. How does it decide? I don't know.
It's very scary. That's why you have to pay attention to your body. Some things really don't surface until it's too far gone and you really had no choice. Like ovarian cancer tends to do that. Pancreatic cancer tends to do that, where it's the same symptoms as so many other issues and cancers, but and sometimes there's no symptoms at all,
right?
Which is scary.
Again, I will go back to what we said in the previous episode. If you feel like something is wrong and you're at one of the younger ages or even an older age, and you go to your doctor and you want them to run a specific test or do something, and they tell you, oh, you don't have anything to worry about. No. Make them document that in your chart that they are refusing to send you for the test. See how fast they send you for the
test. They don't want that smoke.
They don't.
They do not want that smoke at all.
Because I've seen countless stories of people in their early 30s who come in with all these different symptoms. They feel like it could be something based on their Google degree, whatever, or just based on what they know. And their doctor's like, oh, you don't have anything to worry about because you're not even in that age range, or you don't, maybe the symptoms aren't coming together in the way that they typically see them come together. And so they kind of brush it off. But if you feel within your heart of hearts that you should be tested, or you just want to rule it out, tell them to document it.
Look at how our podcast come full circle. Look at God.
Look at it.
No, exactly what she said. And if you have a good PCP like we do, then they will listen to what you are saying. They will take it into consideration, and a really good doctor will send you for your test. Look at how my kidneys were bothering me, even though my labs were okay. He sent me for a kidney ultrasound, and didn't he do the same for you?
He did. I had the pain. Nothing's wrong, but I think there's something.
Did you see on the news recently that that 18-year-old girl had back pain? She brushed it off. It was a UTI, which actually spread to her kidneys, and she was septic, so they had to put her on life support. A UTI, a tract infection, guys. This poor girl she had sepsis and infection throughout her blood, and she was on life support. She's okay now, though. This was in Pennsylvania.
Yeah, you sent it to me.
Oh, did I? Oh, girl, child. Early stages of dementia.
Well, that's another thing, but we ain't on that topic on this episode.
All right. Next thing, lung cancer. So what the American Cancer Society is recommending, between age 50 and 80, for people who currently smoke or who have smoked within the last 20 years, you should get some type of screening. At our old place of employment, her old place of employment, we actually had this, what was she called? Like a lung navigator or coordinator or something, where she was big on cancer screenings, and people would just walk in and they could schedule like chest x-rays or something, right? Yeah. And there was this one lady who came back to visit because she came in for a free screening and they found something. Mm-hmm. And she actually had stage 1A lung cancer and they treated it, but she thanked the the navigator, because she felt like she saved her life.
Yeah, she went on a whole road show. She would speak at different events. She would be at the tables that she would have. But she really was touting like the early detection for those. And there's a bunch of different initiatives that we have in place, or that doctors have in place, I should say, where if you have smoked a certain amount, they recommend doing like a CT scan, just to take a look, because honestly, I don't think the symptoms of lung cancer are that noticeable unless you can't breathe. But sometimes it's just like you have a cough that lingers, and
that's what my grandmother had.
Yeah, it's just kind of a lingering cough, which honestly, most smokers have that, and it could just be from smoking. And then there's those people who have never smoked a day in their life,
who are like, oh, maybe it's post-nasal drip causing my cough.
Mm-hmm. And then also now with COVID, we don't know what anything is, to be quite honest with everybody. And then for those who have had COVID, we have long COVID. Yeah. So could be post-COVID issues. That's a whole different topic, by the way.
It's really hard to decipher. The only way to really decipher is to get scanned.
It is.
And even if, I was telling Jasmine that my grandmother on my mother's side, she was diagnosed with lung cancer in November. She passed away. Well, no, actually, she was diagnosed with tuberculosis. That's what the doctor, her little toy doctor, diagnosed her with. So she was on medication for that. But she ended up having lung cancer, and she was diagnosed in November, and she died in January. So it was very short-lived. Very, very short-lived. Yeah. But that was back in the day when she passed. I was like 16 years old. So medicine is way different now. But you know what I see a lot of? People who have asthma, people who have chronic bronchitis, people who have pulmonary issues still smoke.
Yeah, I mean, it's an addiction, so it's very hard to, I mean, it was designed that way to keep you kind of hooked on that.
It's so crazy to me. You can barely breathe. You're on oxygen. Do you know how dangerous it is to have an oxygen tank over there, and I'm over here smoking?
Oh, and they don't care.
We're like Fire Marshal Bill up in here.
Right. My biggest thing is that in this day and age, in this economy, how you can afford how much are packs of cigarettes?
Some Virginia Slims.
$15, $20 pack of cigarettes?
That's how much it costs?
That would be enough for me. I don't know because I don't buy them, but that would be enough for me to quit because I can't afford to have it.
And some people smoke a pack a day.
Right. They smoke in a
how
one pack,
many come
2,
in a
3
pack?
pack. You asking me like I smoke. I don't know.
I never smoked a cigarette in my life, so I don't even know.
Yeah, I am not a smoker, so I don't know the cost of a pack of cigarettes. I do have people in my life who are smokers, but if they want to fund that habit, they do it on their own. I'm not giving you money to fund that habit because it's unhealthy and it's expensive. And so for that alone, I don't really understand. But once you do start, it is hard to stop. It is an addiction. The tobacco as well as the other things, just the act of doing it soothes you. And so I get it, but also if you know you are a heavy smoker, or you could have stopped smoking and have been smoke-free for decades, and you can still be diagnosed with lung cancer. Just the same, right?
20 years, she was not a smoker.
Just the same as you could have never smoked one a day in your life and be diagnosed, as well as you could have been exposed to secondhand smoke and be diagnosed. So it's really everybody that could be diagnosed, although your chances are increased if you are a smoker or have a history of smoking, especially several packs a day.
Yeah. It's just really, really insane. And a lot of times when doctors do try to have patients stop smoking, which is called smoke cessation, normally they'll like put them on a gum or on a patch. What tends to happen is people pick up another bad habit, being that they're getting rid of that. So, okay, we're not smoking anymore, so let's eat or let's drink.
Right, or let's shop.
Yeah, so people can't really find a balance because, like Jasmine said, it's an addiction. So
transfer addiction, which is also a big thing in the weight loss surgery community.
Oh, really?
Yeah, so a lot of people actually become alcoholics
because they can't eat.
Yeah, if they were using food to cope.
soothe. Yeah. Wow.
Yeah.
Yeah. So just pay attention, guys. Do the right thing, and if you are smoking, here's a little smoke cessation counseling for you. Okay. This whole little segment that we just did. You do not want lung cancer. You do not want them to have to go in and take out part of your lung. You do not want that. You do not want
the, if anyone here is watching that's from the tri-state area, so New York, New Jersey, a few years ago they started releasing these commercials. I know we're talking about lung in particular, but for me in my teenage years, I vividly remember the commercial with the lady and she put the thing up to her neck
with the
trach. Ooh, child!
Yeah.
If that didn't make me want, because we know, okay, it's a possibility, but that's also a type of cancer that you can get. Well, they'll have to start removing stuff, and then you'll be out here sounding like R2D2. So you just don't want that smoke, You don't want that smoke. Literally, those commercials, they impacted somebody, and they're still actually releasing them. I've seen some.
Yeah.
More so on what I've seen lately is the caregiver side of it. Mm-hmm. So it'll be the son that has to take care of the mom,
but I
walking around with
Barbara
I still see Barbara with the voice box.
Barbara, and then at the end it'll say "Rest in peace, Barbara."
Right, because Barbara done passed away.
Barbara done passed away. Her and the trach.
Her auto tune, everything went away. Just as T-Pain. It's not funny. But we're saying all this to say,
put it down.
Yeah, just that.
Tobacco, no bueno.
And if you can't, then just make sure you're getting your screenings so that they can detect it at an early stage.
Yeah, definitely.
So it's treatable. But once you start treating it, it would defeat the purpose if you don't also
if you're still smoking. Yeah. So. One of my uncles who died from lung cancer when I was a teenager, he was in the hospital still smoking. But he said, "I'm dying anyway."
Was that back when you could smoke in the hospitals and stuff?
Mm-hmm.
That's
I'm old.
That's wild.
I'm old. Yeah. Mm-hmm. And he was still smoking, so.
You ain't old. I know what you're saying, but I do remember when you could smoke in all types of areas. Restaurants. It was a huge thing.
Again, I wish they take it out of the casinos permanently.
Yeah, like they did in
how that smells.
Like in New Jersey, you can't in the casino.
Really?
Yeah, they took it away.
I know during COVID they took it away.
Yeah, New Jersey they took it away a few years ago. Pennsylvania though, because we go to parks.
Yeah,
you can still. There's that section.
We need to go back to the casino.
We do. The smoke be floating. What's the point of having? I never fully understood that, but I guess
I can't. It's just.
Going by those things, everybody has experienced secondhand smoke because you remember during restaurants used to be smoking or non-smoking. Mm-hmm. Smoke floats, people.
It does.
So in that sense, if you went out to eat in a restaurant in the 80s and the 90s and even the very early 2000s, you were getting secondhand smoke because people would just smoke at the table
and it
just floats. And so everybody was getting it.
Ooh, child. But now there's no smoking in any restaurants, right?
Right. You got to go outside.
All right. Well, that saves us.
Yeah, that was a big shift, actually. Wow, we are both old.
I'm a little older.
Yeah, a little bit. A smidge.
All right. So the last cancer that I have listed here is prostate cancer. Another one of the cancers where if you catch it early, it's so treatable. So treatable. Sometimes you don't have any symptoms for prostate cancer. They recommend that you start talking to your doctor about your prostate and getting your prostate checked at the age of 45. A lot of men are against it because the doctors check it through your rectum. Yeah. So no man really wants to be bent over while another man is lubed up, has his fingers lubed up, and he's feeling it. But it's kind of like women being clamped on a table and being packed and smeared.
That's not comfortable.
That's not comfortable, but we have to do it, right? So And then they also do this lab test called the PSA, where they are checking your antigen level. And if it's high, I believe it goes up to 4, if I'm not mistaken. The lab. Don't quote me on that. But I think it goes up to 4. And if it seems a little elevated, then they might want to do other testing, like some scans or just a biopsy or like an MRI. Sometimes it's prostate cancer.
And are there some times where the PSA test won't detect it, but the rectal exam will?
I'm not sure because I don't know of any situations like that. What I do know of situations that have happened to people that I personally know is that the PSA level was elevated, which caused them to check for stuff and they found something.
Okay.
Yeah. So a lot of times the cure is to get a prostatectomy, which is to remove the prostate. And a lot of times, if it's caught early enough, you don't have to get chemo or radiation, not even just in case, which is prophylactically. But it has to be caught early because then there are some times when you have prostate cancer and it takes you out.
Yeah. So I think with all of these, right, that's why we're trying to stress the importance of listening to your body, going in for these screenings at the ages that are recommended, but also if you're feeling some type of symptom going in, before it gets to the stage of it spreading to other parts of your body. So that's what we're trying to avoid here, right? So once you get into the upper stages where it's now in your liver, your lymph nodes, your brain, perhaps, now we have a huge problem because
once it's in your lymph nodes, it's pretty scary because now it's in your lymphatic system and it can travel anywhere. So that's kind of scary. And that's why they normally test X amount of lymph nodes when you are getting surgery or having a biopsy. But yeah, everything Jasmine just said.
Yeah.
It's very scary. I've heard some success stories, though, where people have had stage 4 cancer and beat it. I don't know how. I don't know when.
Well, I'm actually watching Grey's Anatomy again right now, and I didn't remember this, but Izzy Stevens, she had like stage 4 melanoma, and she had mets. She had mets to the liver, brain, and to her
I don't remember that.
Her colon.
Did I miss that season?
This is what I said.
No, I couldn't have.
Well, there are 45 seasons, so now that I'm only in season 5, I'm like, wow, I don't remember the storyline at all. But she had some pretty aggressive, and this is a show, so this is not a real story, but she had some pretty aggressive chemo treatments, and all her mets were cleared, and it looks like we know she survives because I know the end pretty much, but
when did I start watching Grey's? Did I miss that season?
No, girl, I'm pretty sure you saw it, but like me, I didn't remember. But that's an example, of course, fictional, but again, has happened in real life, right? Because like they get their stuff from real life scenarios where it is possible to clear the mets out, but that is with very aggressive treatment, very aggressive chemotherapy, which takes a toll on you. Right?
Oh my God, because it not only ruins the cancerous cells, but it damages your good cells too. And that's why you see people so weak and not able to fight off infections and all that stuff. Yeah. You know, when my mom was going for her chemo treatments, the first thing that they do when you get there is take your blood, and you have to wait for your results, because if your white blood cell count, and if your red blood cells are like out of whack, it deciphers if they will give you treatments that day or not. So it's just a lot. Nobody wants to go through that. No one wants to go through that. It's a lot. Mentally and physically, it's a lot. And Jasmine did say that Grey's is not real life, but I mean, come on, lady. It kind of is in our heads. Like, we are like brain surgeons now from watching all the seasons of Grey's.
Completely Derek Shepherd. Like, I can do craniotomies. Like, we're here.
Yeah, like I can do a thrombectomy.
Right.
I have faith in myself based off of just being so invested in Grey's. It's not real life, but in our heads, it's
push the epi and give me the crash cart. Like, I'm ready.
Yes,
I'm ready to go.
See.
What do you need? Look.
Exactly. So, anything else that we need to touch base on with the cancer screenings?
We will go into more detail in future episodes on each of these cancers. Maybe not each of them, but definitely colon and breast. Like, we're definitely going to do full episodes on just those. Where we might have a guest or, I don't know. Or we might just talk like this, but going into more detail about what you should do to prepare yourself for a mammogram, what you should do to prepare yourself for a colonoscopy, aside from following your doctor's instructions, how to prepare if you do get a call back for a ultrasound or a biopsy.
Scary.
And really just like how we can help you guys in advocating for yourselves, as well as answering any questions that you might have before those types of appointments. I think those, in the future, we look to have episodes that go into more detail about that. Screenings, I think we're good. It's just important you go get those screenings.
Be proactive, not reactive. Remember that, guys.
Yeah.
And if you don't know what that means, Google it.
Yeah. I think that's it, though. I think we're good. So,
all right.
Good luck. Get those screenings, guys.
Take care, guys. Tune in next time for more snitching.